Should we lower the BP?
No.
No. Perfect. So we should not lower the BP at all, because that is probably helping the patient. It's giving the collaterals. So even the guideline says when the patient comes into the hospital also, then also we should not lower the BP until unless it's very high. If it's going above 220, 120, then of course we have to lower it down, but we should not reduce it drastically. In a pre-hospital setting, definitely not. So in nutshell, what I'm telling you, you cannot give ecosprin, you cannot lower the blood pressure down, so practically you cannot do anything much apart from telling them you should rush to the hospital. So we should go to the hospital. Easier said than done. We just couldn't find the right thing. So most of the people will think, "Saya chad gaya, ye ho gaya." Humne sabne sune stories. So we have Babas who are getting advanced. They are getting their own CT scanners. They are now hiring neurologists to give thrombolytics. So, not so much in Delhi, but outside we have this issue. Delhi we have issues. We cannot enter the hall because there is a wedding reception going on. And if we have to transfer a patient after stroke, it's a nightmare. So we have to face these challenges, and then we have to ask this question: which hospital to go? Is every hospital, like nearby hospital is the right choice, or going to the right hospital is the right choice? And how do we define which is the right hospital? So there are a lot of standards of practice which has come, which is defining level 1, level 2, level 3 centers. What is a comprehensive, we will skip these criteria, but what is an acute stroke ready hospital? What's a primary stroke center and a comprehensive stroke center? So in a nutshell, if a hospital is not having the facility of at least doing a CT scan also in-house, they cannot be a stroke ready hospital. If they do not have a neurologist, they cannot do a CT scan, they cannot give a patient IV thrombolysis, they are not stroke ready. So if you go to that hospital, or a patient goes to that hospital, it's useless. Because you will go to that hospital, they will transfer you outside for a scan, you waste another half an hour, you come back to the hospital, then they say, no, we don't have the facility now, we have to shift. So you're going to waste a lot of time into that. So at least go to a hospital which has that. Now the other question is, okay, you are blessed with choices. You can either go to a stroke ready hospital, or you can go to a comprehensive stroke center where we have interventionists, labs, everything. A hospital primary stroke ready is like 15 minutes, the other hospital is like 45 minutes. Which one will you choose? 45 minutes actually, because if the distance is more than 2 hours away, then you should go to a primary stroke center. But if spending 30 minutes extra, you can reach to a comprehensive stroke center, you will get a faster treatment. Your outcomes will be different, it will be better. So, and unfortunately, you will have to think about it today. Where do you stay? Figure out which is the nearest comprehensive or a stroke ready hospital near me where I can go, and educate your friends and family about it, because when it happens, you will panic, you will not realize which is the right hospital. So it's about going to the wrong hospital. If you reach the wrong hospital, if the interventionist is not available there to do a mechanical thrombectomy, it's again useless. And I have not put it there, but there are places, there are certain centers where hospital is in Gurgaon, interventionist stays in Delhi. You can imagine, you have reached there, by the time you will reach, it will be 2 hours. So there are a lot of factors which will go into the outcome of these patients. So treating, once you reach the hospital, or a comprehensive stroke ready hospital, and there are numerous in Delhi now, and you can get these outcomes. That, the artery may be blocked, we can use stents to open the artery, and patient can improve on table. Okay, so yeah, so this is just the video. So like, patient had a stroke, she went to a wrong hospital, but she was lucky. She came back, and right after the procedure, she is able to. So she was lucky that way. Okay, so next question is, we all know from cardiologists, what's the golden hour? What's the golden hour for the brain? So for IV thrombolysis, anyone?
90 minutes.
90 minutes. So your choice is 3 hours, 4 hours, 4.5? 3 hours. All are wrong. Wrong. 4.5 hours. So IV thrombolysis can only be given till 4.5 hours. Beyond 4.5 hours, IV thrombolysis cannot be given. So that's the important golden hour. Now, that was supposed to be the simple question. Now the difficult question. How long I can do something, a mechanical thrombectomy? What's the time window? What's the golden hour?
24 hours.
Oh, that's
24
smart.
hours.
Okay, perfect. 24 hours, yes. So now we have a lot of data and trial to show that if the patient comes till 24 hours, we can make difference to these patients. Ideal is as soon as possible, but even till 24 hours, if the patient has good collaterals, we can do mechanical thrombectomy. And why it is important is because all the trials, and I'm going to show you a few of them, not in a boring fashion. So these are the number needed to treat. So just to give you a quick reference.